Glad you could find time to join me today. This is Exceptional Women Show. I am Miriam Gutu. My guest today is Roselyn Cabana, the Program Coordinator of GBV and Psychosocial Health of Nairobi County. Ms. Roselyn.
Thank you, Miriam.
Thank you for coming in again.
Thank you too.
We were here last year. We talked about the silent protest, I guess.
Yes.
You came in.
Yes, we did.
So this year, you've also organized a silent protest.
Yes, this year we hopefully should have it on the 28th of this month in November. And again, we're still doing the same theme. That is from peace in the home to peace in the community. Let's have education safe for all.
Okay.
Yeah, so we hope to be joined by the whole of the Nairobi County because it's being done in one of our sub-counties, that is Tare sub-county here in Nairobi. And we hope to be joined by even our county leadership just to understand what sexual violence is all about and what the survivor goes through.
Okay. For the viewer who is watching silent protest and you're wondering, what is a silent protest? A silent protest is an organized effort where participants stay quiet to demonstrate disapproval. And of course, a silent protest is it a movement? And where did it start?
Well, silent protest is, yes, it's a movement. It started way back in South Africa, where a lot of, we know the rates and numbers of sexual violence in South Africa are very high. And most of the time when cases go up, they're not talked about. And apart from looking at South Africa, I want us to look at our own country, more so here in Nairobi, where when sexual violence happens, we are very comfortable having the matters just end there. They don't go for prosecution and the survivor does not access justice. So that's why the word silent came, for us to feel, for the survivor. What does the survivor go through when they're keeping quiet and they're not accessing justice or they're not accessing health care? And where else can they go to? And who can they go to? And then if possible, what about their reintegration back to the community? Yeah, in matters of sexual violence.
And the stigma that comes with it.
It takes time, and in fact, it's something that we need to look at. And apart from that, where do they go? Do we as Nairobi County actually look at the shelters that are there? Are our health facilities in a position to be able to provide a holistic approach for our survivors? So those are the issues we want to look at and we want to bring in the fore during this silent protest march.
Okay.
Yeah.
So you just mentioned the involvement of the Nairobi County health sector in this year's protest, and of course last year you were also involved. So tell us, what are some of the facilities maybe the Nairobi County, have you put up any new facilities to help in dealing with matters, say, gender-based violence?
We are very happy that we have partners because as I can say, you know, Nairobi County, we are not building any new infrastructure in terms of hospitals. So what we are doing is to integrate GBV services into our HIV programming, because as we are aware, GBV is now also a driver of HIV. And what we are doing is in all the facilities that are providing HIV services, what we call comprehensive care clinics, we are integrating GBV services. And in Nairobi County, we are very glad that we have partners who have supported what we are calling our Tumaini clinics. So for
Tumaini are by the county government?
Yes.
I think I've spotted a few around.
Yes, we have Kibera South, we have Mama Lucy Kibaki Hospital, we have Makadara. We are looking at having Mukuru Health Center also come up. We are also looking at Kangemi Health Center, Mathare North Health Center, and just to make sure that the whole county is actually covered by the Tumaini clinics for them to be able to access the services.
Just let me just cut you short before we continue. From the areas you've mentioned, I can tell from areas which are maybe low income earners, maybe the closer to the slums and things like that. Does that mean that these are the areas where a lot of these cases happen in regards to the gender-based violence?
Yes, these are the areas where we get a lot of gender-based violence. But again, maybe it's because we have created a lot of awareness and people are able to come up and discuss these cases. Notwithstanding that we do have also affluent areas, but maybe the cases are not coming up. We only hear of them maybe in the private facilities. And we're also lucky that even private facilities have also accepted to provide sexual gender-based violence health services without payment.
Oh.
I'm actually talking about Mata Hospital. Mata is the new kid on the block that is providing these services, serving the larger Mukuru area and Fort Nyayo slums. And then we are also having Coptic Hospital, which has also accepted to provide these services without payment.
So when you talk about services, what kind of services are in regards to this?
I'm talking about comprehensive service. When a survivor comes to the service, yes,
okay.
Immediately a survivor comes, you're able to access comprehensive care. Talking about accessing the post-exposure prophylaxis within 72 hours, ensuring that you have gotten clinical management of either injuries, gotten your, if it's ECP, you're in the reproductive health, you're also age, you're given the ECP, and then also you're followed up. And we expect that a survivor should be able to come to our facilities for 5 sessions. Those include even our counseling sessions. That notwithstanding, we expect that even after that, as they go back to the community, depending on where the ordeal happened, if it's back to the community, that we are able to reintegrate them to fit back. Though it's not easy, and that's one of the gaps that Nairobi County is encountering, because we do not have shelters anywhere that we can be able to put our survivors.
So what is the county trying? What is the solution to this? Does the county have a plan to take care of this gap?
I think I'm very happy that you've actually brought this on board. Last year, during the previous county government, we had one nominated member of county assembly by the name Rachel Kamwero. She had actually come up and with a bill that requested that we have 17 shelters. We do have information that this bill was actually passed. And now that we have a new county leadership, we expect that the implementation should start now. And that's why we are also using this forum to ask our partners, if the bill has been passed, we need even just to have one shelter for Nairobi County so that we can be able to put our survivors, to have our survivors go there as they seek other holistic services, access to justice, clinical management, and hospital care.
So the services and the places that you mentioned, the Tumaini
clinics,
how has it been received so far in terms of the numbers, people that have been able actually to access the services? So
far, so good. Between the last quarter, that is July, August, September, we saw 186 survivors, and that is on the lower side, considering that we have been having an industrial strike. Our nurses have been away, so our survivors, and this I'm talking about those who are accessing our public facilities. Assuming that our nurses were on strike, or are not on strike, we think we would have had more cases. I don't want to say those numbers are encouraging. Either we can say that we are doing good in terms of awareness creation, so that they're coming out. On the other hand, we also need to look at our socialization and our norms within the community, so that we don't leave SGBV to the point of only management, but also from our preventive point of view. What are we doing about making sure that the community understands what sexual gender-based violence, creating awareness, having outreaches, ensuring that the community can be able to discuss it openly, because our biggest challenge is that silence. Nobody's talking about it. We want to look at our community, when the matter is reported, to who, where do they go first, and what are the steps taken immediately. We want to have a proper referral pathway that can be able to assist us to ensure that the survivor accesses services.
I just mentioned the nurses strike that I think was called off a week ago now.
Yes, last week on Thursday.
How did that affect, you just mentioned on passing that, but to what magnitude was the nurses strike affected the services offered there?
This is not only for gender-based violence services, but as you are aware, in some of our facilities, even children, we immunize children. So it meant that these children also have to go and be immunized in private facilities where they are paying. Remember that 3/4 of Nairobi County is, we are having people who are coming who get less than $1 a day. And if that's the case, then accessing those services was a challenge. So they had to either go to the private facilities and pay for the services, or opt not to come. So I know there are plans in place for outreaches to be done to be able to cover this gap. But all the same, we need to congratulate our private facilities that have actually stood up with us and been able to see most of our cases. But we can say taken care of, but we can say it's been a very difficult time for us in the health sector with the industrial strike.
And I think it's been very difficult to a lot of Kenyans. I was just sharing with a friend of mine, yesterday I went to Kenyatta. There's a person I know that is admitted there, and she's sick. And so I went to Kenyatta to see her. And then you can tell the people who visit such facilities.
Yes.
And then you wonder, when there are no doctors, when there are not nurses, and these people don't have an alternative, then it hits you how some of these things probably a lot of Kenyans on the other side can't feel it because maybe they have a good health cover and
Yes.
things like that. But it's the Kenyan who isn't able to get an alternative that really gets affected with things like this.
Yes.
So maybe with the strikes and all that, and since the government that came in with the new constitution from about 5 years ago now, the health services were devolved.
Yes.
So do you think so far it was probably not a good idea to have the health services devolved? Maybe we would have stayed with the national government.
Yes and no. No, because there are some services, and I will talk specifically on the program that I'm coordinating. This was under the umbrella of maybe reproductive health. And at that time, most of the services under reproductive health focused on family planning services, maternal and neonatal child health. So the issues of gender-based violence were not so open. The devolved system of government has helped us in that we have hospitals that were not even having doctors, facilities, but they are able to have doctors now. And we have a myriad of services that are going on. And this has helped us a lot in being able to even look at the gaps that we had. And the smallest health facility in even the remotest place in the sub-county you can actually access a clinical officer or a nurse working there. Okay. So we think the devolved unit, it's okay. What we need to have taken care of are in terms of making sure that the industrial strikes are not frequent, because they are hurting us, even us as healthcare providers. We are not happy when we are on strike, because we took an oath to look after patients.
Yeah,
but we are not to protect lives. But when we are permanently in the streets or permanently at home, then what happens to that person who cannot be able to make it to the hospital?
It becomes very difficult to the person who's supposed to benefit from these services.
Yes.
So are there cases of FGM in Nairobi County?
Yes, we have cases of FGM, and this is one thing that we are also requesting, that partners on board to not pass away and think Nairobi is not a place where we have FGM. We do have FGM cases. And these FGM cases, unfortunately, are being done by some of us who are maybe even medical people, and doing it hidden. And then when we do have fatality is when we realize that this was actually a case. So what we are requesting is we want partners to come on board. We are also requesting the anti-FGM board to work with us in Nairobi County, so that at least if we can do a small survey in some of these sub-counties that we are looking at and we know that there is, how we can be able to bring them on board just to understand. Yeah, but I hope you're aware that the anti-FGM board has been taken to court. So then it's not a matter we can discuss for now.
Yeah, I'm aware.
Yes.
I'm aware.
Yeah.
Okay.
Yeah.
So this year's silent protest, how is Nairobi County coming in? What is your role?
Our role as Nairobi County, first of all, it's being done in our county. And we intend to have a rally on the 28th of November, where we shall be walking from the Central Park at the Freedom Corner, all the way to Archives, Nairobi Archives grounds, where we are expecting to also have service provision. We shall be doing cervical cancer screening, we shall do HTS testing, we shall also inform people about our referral pathway for survivors of sexual and gender-based violence once they come to our facilities, or once anything happens in the community, who to go to first and where. We are also hoping to have a document where we can, not really a document, but a pamphlet to show all our contact numbers that will be able, in case a survivor has to undergo such an ordeal, where they can get to
the
emergency numbers.
Are they available 24 hours?
Yes, we hope we have quite a number, so we are hoping that we need to have the ones that are 24 hours. Yeah, and this is something that is being supported by quite a number of our partners, who are key in ensuring that sexual violence in Nairobi County comes to, if possible, zero.
to zero.
Yeah.
I think we're all leaving for that day.
We will. We better. We need to
That
fight for
day.
it at any given time.
Okay.
But on the other hand, also we also need to have awareness creation among our own children. Yeah, because once we overlook our children, you know, the people who actually defile our children are people we live with.
Very close.
Very, very close with our uncles, our Sunday school teachers. And I hope parents, you know that it's not only girls who are raped.
Even boys.
Our boys are being used.
I'm a mother to a boy. I have a son.
Yes.
And I'm very conscious. I think with the cases, you see, you can't just assume. You can't just assume.
I know there was a study that was done sometime back in Embakasi, sub-county, where we were trying to find out how our boys, the first sexual debut. And the first sexual debut of most of our boys was with a house girl.
Oh my
So do we know who we are employing? How conscious are we with the type of relationship our house girls have with our boys? How conscious are we as mothers? Do we have the time to talk to our children about issues of sexual and gender-based violence? In the homes themselves, when we are perpetrators of the same, how do we expect our children to grow up understanding what this is all about? So as much as we are talking about the bigger picture, it has to start from the home.
From home.
It has to start from our community. And it is everybody's business.
So is that what advises this year's theme? What is this year's theme?
This year's theme is from peace in the home to peace in the world. Let's make education safe for all.
Okay.
We are using education because we know that our schools are also not safe. This is where most of our children spend 3/4 of their life. So how safe are they? And so we have customized that theme to say, I need to be safe for Nairobi County. I need to be safe. I need to feel safe everywhere that I go to. Yes. So that anywhere that someone accesses, be it in the matatus. We have heard of our girls being indecently touched in the matatus.
I was watching another
Yeah.
video. A very famous journalist, media personality.
Yes, I saw that too.
You saw that? The
Yes.
video? And she was narrating a story, and for some reason, some colleagues of mine laughed about it, and I thought, you don't understand. Person touching you without your consent.
Yes.
I can't even.
It's intrusive.
It as a woman.
Yeah, this is my privacy.
I
This is
know.
mine.
And the way
I always
she's
tell people,
explaining
this is
it,
mine.
I know, it's so violating.
Yes. So we feel that we need to have peace all over.
Yeah,
It's
yeah.
just not about in the home, but
Yeah.
everywhere that anyone goes to. We have just started the holiday. Holiday season is so long. Has anybody bothered to sit with our children? I can see all parents running left and right to ensure that even after kids have closed school, we still want them to be somewhere else. How are we engaging with our children? It is important, much as we want other people to look after them. What time do you have with the children? Because if the children know that this is wrong, a child should know what is a bad touch from a very early age. They don't need to be around 12. When their own cousins are molesting them, then they start saying that mom so-and-so touched me. This has to come from the beginning. You tell your daughter, I need you to understand, it's not everybody who has to keep touching you here. You need to know this is a bad touch. You need to know when you're going to play, somebody does. You need to explain to your child when she comes to you. When she comes from school, you need to know who she played with during the day in a conversation with an appropriate age language, a language that is comfortable to the child and the child can understand. Get the words, understand what the child gets, meaning it means to her what this is. I'll use Kiswahili. Toto, hii ni dudu. Dudu ndio hiyo imepita. And then immediately the child asks you, Mom, hii ni nini? And then you still tell the child, hii ni dudu. So how are you trying to make this child understand that dudu and this dudu are different?
How do they even relate?
How will they relate? So let us use age-appropriate language, information that can be understood by them in simpler terms as they grow, so that they know that they can be safe with anybody at any given time. Yeah. So even as we go into the silent protest, remember it is starting on 25th and culminating also on the 10th of December, where is the International Human Rights Day. So our activities are not only covering
the 16 days
the 16 days of activism. We shall have, and amongst even the days, we shall also have the International Day of the Disability. We have the World AIDS Day. So we have quite a number of activities that we need to put together in this time. Yeah, all to make sure that vulnerable members of the society are able to understand what their violation of rights mean, where can they go, who is there for them, what is being done in terms of psychosocial, what is the referral pathway, who can I talk to, how can I access my drugs, which facilities are providing services without payment, and in the event that I go to these facilities, what services am I expected to be given? Because most of the time the survivors don't even know what they're supposed to be given. So when they go there and they feel they have reported and somebody has seen them, and they will still go back. Did they get the PEP, that is the post-exposure prophylaxis? Were they treated for STIs? If it's a lady, was she given ECP? If it's a young child, were you screened? I mean, was the person also screened for HIV? Because right now, we need to know that for any HIV, someone who is living with HIV, it is also very important to screen them. If it's ladies, for intimate partner violence, very important. If it's children, we need to screen them to know that they have not been abused, so that we don't, when we are approaching the child, we are looking at them holistically in all ways. So at this 16 days, we have those activities and we want them to come out very clearly. We also don't want to leave the idea of men. Men are seen to be perpetrators. We need their engagement. And that is why even during the rally that we'll have at Archives, we are expecting to have what we call a women clinic, where we want men to come in and be able, we look at their health-seeking behaviors. Yeah, we assume them because most of the time we see them as perpetrators. We think sometimes they're not supposed to be sick. And of course, when they get a cold, everyone in the house has a cold then, because it's something small, but it's very big for them. So we need them to also, we need to understand their patterns of health-seeking behavior, so that they also know that when they come to the hospital, we can also give them a first priority. When we are fighting issues of sexual and gender-based violence, we want them to be the first ones in the front line, because they're the ones to be able to engage our children. They should be able also to engage our children, so that it's not only mommy talking about bad touch. Even daddy can be able to correct you, so that we reduce the number of perpetrators that we have. Yeah, and ensure that they are also, when it comes to community, perpetrators, they will go in and they'll come out. Where are they going to go? They're still our
Back
people.
to the community.
Yeah, they're still back our people. Yes.
All right, Roselyn. I know there are lots we can talk about, but you're one of your partners.
Yes.
Faith is coming in to finish the last bit of the conversation.
Yes.
But it was a pleasure to have you today on the show, and hopefully I'll show up in one of the events.
Yes. You need to be there. Come and walk with us. We're expecting our county leadership, and at this juncture, maybe I will just take this opportunity to actually invite our Honorable Governor, His Excellency the Governor, to be able to be with us during the rally. If possible, we would want our First Lady to join us. And we are lucky we have our women rep, who is also very passionate about this, Honorable Esther Pasaris, and even our member of County Assembly, Madam Beatrice Elachi. So we are hoping they'll be able to join us for this activity.
All right.
So thank you very much.
And if I find time, I'll also join you.
I am not like leaving you out of this. You have to be there.
I have to be there.
Yes, you do.
All right. Thank you so much, Roselyn.
You too.
And
happy to be here.
Okay. We'll be right back. Don't go too far. Welcome back. I'm now joined by Faith Monday.
Yes.
One of the organizers for the silent protest.
Yes.
Thank you for joining me again.
And thank you for hosting me again.
For the third time.
Yes, for the third
It's
time.
my pleasure.
Thank you too. Thank you.
So, for the viewer who probably is watching for the first time, just briefly introduce yourself.
My name is Faith Ndungu. I work for AIDS Healthcare Foundation Kenya, which is an organization that is working across the country, and Nairobi is one of the counties that we are working in. And it's really a pleasure to be here today to talk about the 16 days of activism, just to reflect and see what is our role as citizens really when it comes to issues around GBV, but most importantly also having worked for an organization which deals with issues around HIV, just also to see that we all have a part to play, both as a citizen but also as an organization in the HIV sector.
All right. So I know you organize organizing the 16 days of days of activism.
Yes.
So it starts on?
It starts on the 25th of November and runs to the 10th of December. And so we have different activities. The country has different activities. Specifically with interest in Nairobi County, we have activities starting from the 25th itself, when is actually the official launch. But we also have activities from the 25th, where we have a march and sensitization in Dandora through the five faces of Dandora. Then we also have different activities, including the silent protest on the 28th, and different activities follows through until the 10th of December. So we're really happy that we are in media. We are passing information to people, for people to to create awareness and for people to realize that we have specifically looked at the 16 days and asked ourselves, why is it that we shun away from talking about issues about violence, issues about sexual violence, which includes defilement, rape, So we're happy that you're hosting us, and this is our first media interview, which really is great for us. And thank you, because it shows that you're taking an active role in sensitizing people, and for us, would like to really stop issues around sexual and gender-based violence. So this is an avenue to reach more people, to make them understand that it is not good to violate anyone. It is not good to be violent.
Okay.
Yeah.
Okay. So you mentioned Dandora.
Yes.
Is there a specific reason why this march will take place in Dandora?
For the Dandora activity, it's been organized by one of our partner organizations who are going to, they've looked at it, and the name of the campaign itself in Dandora is Kombi Sipoa. Kombi Sipoa. Kombi per se is slang for...
Is it a combination?
It's...
Or several people,
Yes. So it's set by a number of people.
Okay.
And in Dandora
there
there
is...
is...
a number of people.
Yes, so in Dandora it's one of the vices which is growing, that many young girls are not well empowered to know that they're not supposed to... that it's really, they have negotiation grounds on how to engage. And so we're sensitizing the community, both the male and female, on the harms of Kombi, and especially because that is one of the fuelers of gender violence, because some of these girls are not engaging in Kombi because they want to, is because they are vulnerable. They can negotiate for not to engage in sex. And also, again, that is also a driver of new HIV infections, because it makes a person vulnerable.
Oh, wow. So a girl will have like 4 sexual partners.
Yes.
For her to feel safe, or in the community, or protected, or what is it?
Yeah, there are those many factors. So in a way, it's for them to feel like they belong. So that gives them a sense of... I'm actually sleeping with this gang or this group of men who are seen in the society as,
So it's actually a privilege.
It's actually they take it as a privilege, but unfortunately, it's because they are not well empowered. They are not. They are not empowered for them to realize that actually this is not the right thing to do, and also that they are exposing themselves to being vulnerable to getting HIV and any other STI. Yeah.
Okay. So we had a lengthy conversation with Roselyn here, and talked a lot about the GBV.
Yes.
And of course, this year's theme centers around that.
Yes.
So what does the statistics say so far?
When you look at the data, you realize that, yes, the numbers are still increasing, and the good thing is we have social media now, so access to information is available. And when you look around, you'll see, like when we had the Me Too campaign, you saw the number of people who actually came out and said,
Me Too is harassment.
Exactly.
From Heinstein?
Yeah, and people picked it as, have you gone through any form of sexual violence? Because even harassment. And when you look at that and you saw the magnitude of the number of people who are engaged in Me Too, that shows you that through that lens, that actually there's a lot of increase.
On Lupita Nyong'o also was
Exactly.
said she went through that.
And there are many more cases that when you look around, you realize that more people are vulnerable. Maybe there are aspects that we need to also look at and ask ourselves as a society. How do we deal with issues around depression, issues around different vices? Because there are people who are finding themselves as perpetrators, and maybe there is a background to it that people saw it coming, and they didn't realize, like in family setups, you may hear an uncle raped his niece, and when you look at it, when they start talking about it, you see that there is an history around it, but people didn't take up issues around counseling. And that's why even as we are thinking about the silent protest, we are keen on all aspects around services that you get when you become vulnerable. And one of the services is counseling, because that is a missing link that we need to also look at, especially in preventing. Because as much as we are talking to people, and I'm happy that Madam Roselyn spoke about that we are encouraging people to the services which are offered, to facilities with services. We're also looking at how do we prevent this. And this can be prevented if the society is more vigilant, if we don't celebrate vices. Like, I'll give you an example. Look at, there are many times that in the media we see stories and headlines that a class standard 8 girl delivered during KCPE. And we don't go to ask ourselves what really happened. Maybe that was defilement, you know? So these are aspects that we normalize in the society, which we need to look at deeper. We need to break that silence, because the people are going through that. Like for those girls who deliver, when they are doing their KCP, for example, no one sits and no one has taken the time to look at what is the story behind this, what really happened. And so this girl is put in a situation whereby she's silenced by the society. So we want to, yes,
what you're not.
Exactly. So we want to break all this silence and see if we can unite as a society, because sexual and gender-based violence are aspects which are within us, and it calls us to deal with it from within us. And yes, as programmers come in, as the governments come in to look at these aspects, we also need to look at them from our own bases, from our own homes, from our own mentality and perspectives. Yes.
Okay. So what are some of the societal issues that silent protests have successfully addressed so far?
Some of them really is, like, we are happy about the Dandora campaign, because this in the Dandora society is almost like normalized. But at this point, people want to break that silence. Would also say that people just reporting the cases is breaking the silence. So the silent protest over the years, when it started in South Africa, it was not just looking at you reporting, but also building the survivor. So would say that there's been that growth within the survivors accepting and moving on with life, but also there is that aspect of also informing, reporting cases. And we are hoping from this year that we are going to get more safe places for people. And this, we are not just looking at the government, we're also looking at other players, including the religious society, because those are also avenues where we can get safe places that if a person has been, for example, has been raped from home, you don't go back home after reporting. You need a place where you can go to, a safe place. So that's what we are hoping from this time. We are going to get commitment that people are going to move into having safe places. And yes, also support the initiatives that organizations have, including hotlines, that people know that they can access services, they just need to call. Yes.
Okay. Oh, wow. So what will be the highlight of the whole event, all 16 days of activity?
For us in Nairobi County, would say the highlight would be the silent protest, really, because we are having two activities in one.
So the silent protest is the one that will happen
on the 28th.
On the 28th?
Yes.
Okay, so the 16 days of activism starting the
25th of November.
So the 25th is when you go to Dandora?
Yes.
Okay.
And nationally, the 16 days will be launched.
Okay.
But on the 28th is when we are going to have more or less our biggest activity within the county, which is twofold. We are going to have a march starting from Uhuru Park Freedom Corner, walking through towards National Archives, and we are going to have a rally there.
So by rally, you mean that's where you have the silent protest?
Yes, that's where, actually even the march itself, because we are sensitizing people. So we are going to be marching and with tapes on our mouths, signifying the silence, but we are going to be giving the flyers that Roselyn was talking about, with hotlines in case of this is where you can contact. Then at National Archives, that's where we are going to have now the rally. Survivors talking, policymakers talking, and also technical people speaking, but using the same platform. The survivors will bring in that if this was there, I think I would have handled my situation better. Then from the technical side and the policy side, we need commitments that this is what we'd like to do. And in the course of the 16 days and years, 2018, then we hold them accountable towards that. But also rallying together, having a united voice and saying that we really need to start talking against sexual violence. Let's not normalize. It's nothing to joke about. Because if you go to social media, people nowadays even joke about the word rape. And people use it as a passing word. And so for us, we don't want to normalize rape. It's nothing to be happy about or use it as an example. So those are things that we want to break that silence so that when we get to those platforms, we have the freedoms. People also realize that there are many vices that we need to break within the society. And there are many avenues that are there that people can get support and help.
So it's time to speak up, and I hope you make time for the 16 days of activism. And if you can find your way to Dandora on the 25th, that's when they'll be having the march, and also on the 28th, when they'll be having the silent protest starting from the Freedom Corner at Uhuru Park to the archives. The time? You didn't mention the time.
From Uhuru Park, we're starting from 8, but at archives, we're starting from 9:30. Yes.
So there's no excuse. If you can't make it to Uhuru Park, you can join them at the archives. And until next time, Faith, it was really a pleasure to have you on the show again.
And thank you for hosting us.
And thank you for the good job you're doing and helping out in the community. And until next time, this has been the Exceptional Women Show. I am Miriam Ogutu. Thank you for watching.